Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about pregnancy week 29. So some new signs and symptoms that you might be having. You might be having some shortness of breath. I'm actually experiencing this right now. So this is because when your baby starts to go head down, they're going to start to kick on your diaphragm instead of your lower pelvis, which is going to push on your lungs, causing you to be a little bit shorter of breath. You might also notice some hemorrhoids forming. So this is very, very common in this stage, mainly because your placenta is starting to grow more and more, and it's going to put a lot of pressure on your different organs as far as the blood vessels, so it can cause some hemorrhoids. So what's happening with baby this week? So with baby, their head is starting to expand more, and this is because their brain is continuing to grow, so their head must expand in order for their brain to grow. Their taste buds are starting to transmit more nerves and receptors to the brain, and their bones are going to continue to harden, which this is going to continue on for quite a while still. This week, baby is the size of a butternut squash, which is roughly about 15 inches long, and they're weighing about 2.5 pounds. Now, as far as being in your third trimester, as far as when you come in to see me, this is when things pick up a little bit. So like I said before, your first and second trimester, if you're coming to see me, if you're in no pain whatsoever and you just want to be treated for your pregnancy, we typically follow your OB schedule, which is about once a month through your first 2 trimesters. Now that we're starting to get into your third trimester and getting closer to your due date, we're actually going to increase that frequency. A lot of the reasons is because, especially your last month, month and a half, your belly's going to pop out more, baby's going to drop into your pelvis. A lot of big changes are happening in a short amount of time, and a lot of our natural body's responses are going to be to tighten up to protect it. So this is when we actually want everything to be looser, so when it comes time for labor, everything opens nicely. So that's why we kind of increase your frequency the closer we get to your due date. So if you have any questions about this, anything about prenatal care, as far as just regular prenatal care or pain care, give us a call here at the office. Thank you.